Although the COVID-19 pandemic is ongoing and we are all still suffering, there is another current, and in many ways a consequential, crisis that demands attention. Research going back for decades reveals that mental and substance abuse disorders are a top dally for countries worldwide, increasing by nearly 10.67 million from 2010 to 2017. DALY, or Disability Adjusted Life Years, measures the burden of disease through summations of mortality and morbidity across countries. One DALY is equivalent to 1 year in good health lost. Mental and substance abuse disorders ranked number 4 in burdens of disease for the United States in 2017, with a DALY of 7.21 million. In this same year, Sub-Saharan Africa saw a DALY of 13.56 million, China had over 22 million, and South Asia 28.53 million. Imagine what the jump from 2017 to 2021 would be if we had the numbers available. There's evidence to believe that such a global, traumatic, and long-lasting event as the pandemic has affected mental health significantly across the board. Major depressive disorder often carries the heaviest burden, with drug use and anxiety disorders close behind. In 2015, an estimated 322 million people lived with depression, half of whom were in Southeast Asia and the Western Pacific region. This silent epidemic is even more concerning than ever before, as recent studies reveal depressive symptoms may have nearly tripled since the start of the pandemic. This makes sense, as it is a personification of just about every stressor you can think of, from unemployment to financial insecurity, death, and isolation. We are dealing with economic and psychological depression, where one cannot be addressed without the other. Policymakers need to prepare a multifaceted, multi-level response for recovery and prevention to be as successful and efficient as possible. As a growing global crisis, this is not an opportunity to spread Western biomedical approaches to mental health. Failing to implement policies that are culturally consonant and evidence-based would be a moral failure to humanity. The World Health Organization believes that task shifting may allow for more equitable implementation of treatment. Task shifting is the redistribution of tasks among paraprofessionals to support specialists. If also trained with community-based knowledge, this can effectively increase access to mental health treatments and reduce stigma. But of course, there's more to it. Expanding mental health care requires comprehensive policies addressing social, economic, and environmental determinants that are aware of how certain populations are at more of a risk than others. Everything from poverty to gender inequality factors into the burden of mental disorders. Global institutions of politics and economics create power imbalances that produce consistently poor health outcomes in poorer regions or against minority groups. Women, BIPOC individuals, and the LGBTQ+ community are all facing additional stressors on top of the pandemic. This includes economic disparity, institutional racism, social stress, and so much more. We should be working to prevent, as well as treat, a full spectrum of disorders. How we address COVID-19 and increasing mental health issues will be reflected in post-pandemic society, and so we should do everything possible to support those struggling. I encourage you to find resources regarding the pandemic and mental health, and know that you are not alone in these difficult times.